My name is Dr. Brian Gross. I work for LewisGale Physicians. I serve here as an otolaryngologist, head and neck surgeon. I've been here for about 3 years. So one thing that's very important to me as a head and neck surgeon is that every incision that I make can be seen by friends, family, the public. And so every time that I do a surgery, I want to be sure to plan the surgery and plan the incision so that I can make the incision and the scar afterwards the least noticeable. With thyroid surgery, that's always important because we're making the incision right in the bottom of the neck. So there's a few things that I do to be sure that we make this as hidden as possible. I usually use a tiny little skin crease that people have in their lower neck. And then I also use meticulous closure techniques so that within a couple weeks to a couple months after the surgery, there's a tiny scar that most people don't even notice. Thyroid surgery is it's a common surgery, but it does require a lot of training. When I was at Mayo during my residency, we had intense training in thyroid surgery, as well as in general the management of the thyroid, a patient with a thyroid disease. While I was at Mayo, I spent 5 years there, each of those years doing many thyroid surgeries. When I got to the end of my residency, at the end of the 5 years, my mentors knew that I was very interested in thyroid surgery, and I was invited to be the primary author of a chapter in a review book specifically on endocrine surgery. So that allowed me to study the thyroid in more detail, and then that was ultimately published. And then since being here, I'd say about 50 to 75 thyroid surgeries that I've done each year over the last 3 years that I've been here.